Hey everyone, my name is Mario, and today we're going to be talking with our patient advocates. We're going to learn about their roles and their responsibilities and talk about the services that they offer. So come with me as we meet some of the team members. Okay everyone, so now we're joined by Philip with our customer service department. I'm going to have him introduce himself.
Hello, my name is Philip Amsity. I'm the Customer Service Director for Gila River Healthcare.
Hey Philip, good to see you again. So Philip, can you talk a little bit about the customer service department and the different aspects that you guys have?
In our customer service, we have the customer service representatives who are highly visible in the clinics. All three clinics, we have them. They're there to help and provide services for any patients, anybody that comes that needs help. And we also have the patient advocacy department, which is also available to everybody here in the community. If anybody needs services, they are available for them.
Philip, could you touch a little bit on the purpose of the patient advocates?
Yes, the purpose for the patient advocates is to assist the patients in anything that they need in terms of complaints, grievances, and or compliments.
Well, Philip, thank you for your time and for that information about the department. We really appreciate it, sir. Have a good one. Hey everyone, so now we're joined with Helena, one of our patient advocates. I'm gonna have her introduce herself.
Hello, I'm Helena Lewis. I'm a patient advocate from Red Tail Hawk. I'm a community member from District 5.
Well, Helena, thanks and good to see you. Helena, can you tell us a little bit about what is a patient advocate and what are some of their responsibilities?
As a patient advocate, our role here in the hospitals is to take grievances, complaints, compliments, and also requests from the patients. What we do is we help them with their concerns with the hospitals or with the employees.
Great. Helena, can you touch a little bit on the importance about advocating for our patients?
The importance of advocating for our patients is to be able to help them with any kind of problems that they have or any kind of issues that they run into while they're here at our facilities. And we try to help them with anything that they have concerns with, so that way their visits go smooth and their health care's prompt and taken care of right away.
Helena, thank you for that. Helena, I want to ask about what is a patient advocate report, and then how do the patient advocates receive that report?
Well, for a report, it can be any kind of report. Like I said, we take grievances, compliments, requests, and concerns. So all our reports are different. They're never the same. And the way we get our reports is we either meet with the patient face-to-face. Sometimes they'll request us to come out into the lobby and we meet with them, or we can be at our desk and we get a phone call. And as soon as we get the report in, we have to get it out. We write the report up and we get it out to the department director.
So Helena, once a report is made by the patient advocate, what can our patient expect?
So once the patient talks with the department and they're satisfied, I follow up with the patient myself to make sure that they're satisfied with the response that they got from the department. And then I go in and I close out the report if the patient is satisfied.
Well, Helena, thank you for that information. It was great. And we really appreciate your service. So have a good one.
Thank you, you too.
Hey everyone, so now we're with Veronica, who is our patient advocate coordinator, and I'm gonna have her introduce herself.
Hello, my name is Veronica Gonzalez. I'm the patient advocate coordinator here at Gila River Healthcare. I've been with Gila River for 4 years. I started off as a patient advocate.
So Veronica, thank you. As the patient advocate coordinator, can you talk a little bit about your role and some of your responsibilities?
Sure, Mario. We're actually a team of 8, including myself. We're located at HHK, Red Tail Hawk, Kamaki, Ak-Chin, and at the Cairn House. My job is to help guide the patient advocates and to oversee their reports and see if there's other opportunities that we can help assist the patient and just do that little extra to treat them like family, to go over and beyond.
So Veronica, thank you. You mentioned that we have a team of 8 advocates. So from a team approach, maybe could you talk a little bit about how do we work through some of maybe the issues that come up?
Yes, Mario. Even though we're located at different facilities, we speak to each other consistently. We're always looking at different opportunities to help each other with each other's reports to see in case we are missing something and kind of go over and beyond to help assist the patient to make sure to correct any kind of experience or just pass along any kind of compliment that they have regarding Gila River Healthcare.
Veronica, thanks for that. I really would like for you to touch on if our patients are having a concern or an issue with their service, how would you recommend they go about that?
we don't only just do concerns in our department, we also do patient requests if they feel like they can't get in contact with their provider or a nurse. And we also do compliments, and a lot of people don't know that. If there's that special employee that kind of touched your heart that day, we also take that. We want to hear the positive, and we also want to hear any concerns that they might have. Usually it happens is like if a patient has a concern, they try to handle it within the department. And if for some reason it doesn't work out and it doesn't happen and they feel like they need to speak to somebody else, then the patient can reach out to us and say, you know what, I have this concern, it's bothering me and I feel like I'm not being heard, or whatever the issue may be. And we can help assist them or help guide them or help explain or anything that they might need.
Veronica, thank you for that. Veronica, I can imagine that some of the issues that you guys work on can be really tough. Maybe can you touch on, how does the staff ensure confidentiality and privacy?
Yes, Mario, some of the issues we deal with are difficult. However, we still have to follow HIPAA and make sure that we stay within our CMS guidelines and our policies and procedures along with HIPAA.
So Veronica, could you touch on your experiences as a patient advocate and a patient advocate coordinator?
I started off as a patient advocate and then eventually became the coordinator. I'm very passionate about my job, just the fact of being able to help my people. That is the biggest passion, and I'm privileged, and I feel privileged to be able to do that with my job. It doesn't even feel like I'm at work.
Well, Veronica, thank you for your time and thank you for the information. I appreciate it.
Thank you, Mario. I appreciate you having us and the opportunity to tell you a little bit about our roles.
Hey everyone, so now we're joined by Danielle, who's another patient advocate. I'm gonna have her introduce herself.
Hello, my name is Danielle Enos. I'm a member of the Gila River Indian community and I've been with the organization for 14 years and currently I'm a patient advocate with customer service.
Danielle, when the patient comes to you and they have a concern, can you walk us through your process and how do you handle that?
So the main important thing as a patient advocate is that we listen. We're here to listen and we gather all the information, their core issue that they have, and apologize if needed, because sometimes they have a negative experience, and what we try to do is just try to let them know that we're here to help them, to be a voice if they need to address something, and we will go ahead and take the concern. We let them know our process and that they will be contacted within 7 calendar days.
No, Danielle, thank you for that overview of the process. Once a resolution's in place, what does that look like for you?
Sure. So once a resolution has been reached, we go ahead and we contact the patient just to verify that they were contacted by a representative of that department, and just if the resolution for them, the conversation went well, and then we ask for permission if we were able to, close out their grievance.
Danielle, when is it a good time for one of our patients to contact a patient advocate?
Sure. So even if they are in the process of having their visit in the clinic, if they request us, they can ask a staff member and we will go ahead and meet them in person to hear their concern. And also if, a few days pass, people are on the fence about contacting patient advocacy, they can go ahead and give us a phone call. We have business cards all throughout the department, and also email. They can email us as well.
Danielle, thanks for that. Danielle, what are some of the most rewarding aspects of your job?
So as a community member, being able to assist with our patients, especially the elderly patients, saying, they're not able to get a hold of a certain department or they're making arrangements for their visit, being able to find a resolution for them, that's the most rewarding aspect of the position.
Well, Danielle, thank you for your time and thank you for your service. We really appreciate it. Have a good one.
You too. Thank you.
So big thanks to our patient advocates and all their services that they offer. If you enjoyed the video, please like it and share it. And until next time, we'll see you.